Hello everyone. Today we'll talk topic of nutrients. Okay, that is type 1 and type 2 nutrients. It is a very important short notes for your university exam, both for your UG and PG university exam, right? Yes. We require around 40 micronutrients for our growth. So we require 40 micronutrients for the body growth. Among these 40 micronutrients, we have been divided into type 1 and type 2 nutrients. Let me talk with the example, take you with the example so that you can easily understand what are these type 1 and type 2 nutrients. For example, type 1 nutrients are your iron, iodine, B complex, and your fat soluble vitamins like A, D, E, K. These are your type 1 nutrients, whereas your type 2 nutrients are your essential amino acids, essential fatty acids, your potassium, magnesium, zinc, chloride, sodium, nitrogen, everything will come under your type 2 nutrients. So what will happen when this particular nutrients are being deficient? So that is the topic here. That is the difference between type 1 and type 2 nutrients that we are going to discuss. So what will happen to the growth? So growth continues to grow. The patient or the child will continue to grow in an early stage if there is a type 1 nutrient deficiency. This type 1 nutrient deficiency, the child will continue to grow. So these type 1 nutrients are nothing but your functional nutrients. These are your functional nutrients. When these are particular nutrients, if there is an iron deficiency, the child will continue to grow in her early stage deficiency, right? So the body will consume the body stores. This iron, there will be a body stores in your iron. So the child will have the iron stores. So the body will use the stores first. Only when there is a deficiency of the stores, the child will go in for a growth failure, right? So the baby will continue to grow and the body will consume its body stores. Body stores, and then it will have a reduction in the bodily function that depend upon the deficient nutrient. Okay, and then there will be a reduction in body function that depend upon the deficient nutrient, whether it is iron deficiency or iodine deficiency or your A vitamin A, D, E, any deficiency, it will depend upon the particular nutrient. Okay. Well, coming on to your type 2 nutrients. Type 2 nutrients itself separately, this type 2 nutrient itself separately a short note, right? Yes. So type 2 nutrients are nothing but your growth nutrients. So these are your growth nutrients. Okay, when there is a deficiency of your type 2 nutrients, the first response is growth failure. So first response of your type 2 nutrient deficiency is your growth failure. So whenever there is a deficiency of your type 2 nutrients, whether it is zinc, selenium, magnesium, anything deficiency, the child's body will react. How it will react? The muscles, the body will take up the stores, this your selenium, zinc or something, whatever it's being deficient, the body will take up the stores from the muscles. So the baby's body will eat her own body. So like that, okay, like how in cancer the cells will eat up your own cells. Adu madri da, there is a growth nutrient deficiency, body will eat upon its own body. So the body will extract the nutrients from the muscles. So baby will stop growing. They will conserve the nutrient in body to make it internally available. So these will conserve the nutrient in body and make it internally available to the organs. So and make it internally available to the organs to maintain the nutrient concentration in the tissues and maintain its nutrient concentration in the tissues. So here, if there is deficient, if this is a muscle, okay, for example, if you take this as a muscle, so the body will take the nutrients from the muscle. So if the nutrients are taken from this, consider for example muscle, if the nutrients are taken up from the muscle, muscle will become shorter or thinner. muscle வந்து ரொம்ப thin ஆயிரும். So when muscles become thin or thin, that will lead on to what is called as acute wasting. When this acute wasting is being progressed, if wasting is being progressed, adukapra what go, it will go on to chronic malnutrition, that is stunting. So there will be a as a result the child will go into growth failure. Okay ma? So when there is a deficiency of type 1 nutrient, the child will have a specific clinical signs and symptoms pertaining to a nutrient that is being deficient. So there will be a specific clinical signs. While in type 2 nutrient deficiency there are no specific signs, only growth failure. There is no specific signs. If zinc deficiency na idu varum, illa magnesium deficiency na idu varum, illa what is that nitrogen, chloride, sodium deficiency na idu varum, andha maadhiri edhu irukadhu. There is no specific signs for particular deficiency. So the child enna deficiency irundhalum first failure will be a growth. Okay, next, how about your body stores? There will be body stores will be available for your type 1 nutrients, while there is no body stores for type 2 nutrients or your growth nutrients. How will be the tissue concentration? There will be a particular tissue that is concentrating the nutrient here. So for example, in calcium, if you take calcium, the bones are the main thing. Bones are the main thing that is concentrating your calcium. If you take iron, iron stores are mainly available in your liver. If you take iodine, iodine specific growth will be your thyroid gland. So on the mother there will be a specific tissue, particular tissue for particular vitamins. Adhe one, if you take your type 2 nutrients, there is no particular, not they are not present in any particular tissue. They will be in all the tissue. It is not in any specific particular tissue, right? Yes. What are its effect? It will affect a specific enzymes. This will affect specific enzymes. Well, type 2 nutrient, this will affect the general nutrition or general metabolism, right? Yes. How this BM is nothing but breast milk. How about their stores in breast milk? Stores in breast milk are variable. This type 1 nutrients will be variable, while type 2 nutrients are stable. There will be a stable stores of particular sodium level ivlo irukuna avlo irukum, zinc level ivlo irukuna avlo irukum. There will be a particular or stable amount of your type 2 nutrients will be present in your breast milk. What are the effects of other nutrients on tissue concentration? If there is an iron deficiency, it will be independent of your calcium or it will be independent of your iodine. So it is an independent. It is independent of other type 1 nutrients. What about your type 2 nutrients? They are dependent. They are dependent on other type 2 nutrients. Okay, right. What will be your biochemical abnormality? Biochemical abnormality, that is we are using it for diagnosis. If for example for iron deficiency, you will be taking serum iron level, your HB level, your ferritin level, everything you will be taking. So there will be a biochemical abnormality that will be used in diagnosis. Okay, well, pertaining to your type 2 nutrients, there won't be any you can have your magnesium level, zinc level to look upon this, but everything will be interrelated. It won't be any specifically you can find it. Okay, what about your anthropometric abnormalities? Anthropometric abnormalities, it will appear your growth and your your weight and your height will appear late in these deficiency, while anthropometry is the base for your type 2. This is diagnosed by your anthropometric abnormality, right? Yes. So these are the main points regarding your type 1 and type 2 nutrients. How about anorexia? Anorexia will be present mainly in your type 2 nutrient deficiency. It will be absent in your type 1 nutrient deficiency. And the examples of type 1 nutrients, as I already told, these are your iron, iodine, copper, calcium, this is selenium, B complex vitamins and vitamin A, D, E, K. While your type 2 nutrients are your essential amino acids, potassium, magnesium, phosphorus, sulfur, zinc, sodium, chloride, nitrogen and essential fatty acids. These are your type 2 nutrients. Okay, this is a very short topic regarding for easy understanding for your type 2 and type 1 nutrients. These are functional nutrients and these are your growth nutrients, right? It's a very important short notes, and it's very useful for your clinical practical purpose also. So please, so that only we are telling, please measure the weight and the height, head circumference, mid upper arm circumference for any child who are being admitted in your ward or being coming to your OPD. So because these are your basics, and these are very basic for your pediatric practice. These are your bread and butter for your pediatric practice. So please do measure weight, height or length, plot it in a growth chart, and over a period of time kindly follow the child whether it is going to the flattering or not. Why? Because we are telling so many times regarding this malnutrition and nutrients are because there are 2 billion children in India, overall India, 2 billion children overall in India who are being malnourished. Okay, so please do measure this, and because they could be going into hidden hunger. What is called hidden hunger? Hunger na namakku theriyum because they are deficient of your calories. Again, they are inadequate calories. So they are being hunger, but they are being inadequate of calories. Mainly it is your hunger. What is hidden hunger? It is lack of balance in the full diet. This is also in separate